Hi, everyone. My name is Katie Brumfield. I'm the manager of career services at the Colorado School of Public Health. And today we are going to learn about James's career. James, would you mind kicking us off by introducing yourself and where you work?
Hi, everybody. I'm James Montavon. I went to Colorado School of Public Health a couple years ago, and I now work for Blueprint Biosecurity, which is a nonprofit focused on advancing humanity's ability to prevent pandemics.
Wow, that is really cool. And so when did you graduate from School of Public Health?
Wow, time flies. I think I graduated December of 2023,
Okay,
so just a couple years
nice.
ago.
Cool. And what was your concentration?
No, sorry, 2022.
Gotcha.
Um, Epidemiology.
Okay, great. Good, 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 good. Okay, cool. Um, so what inspired you to pursue an epi degree?
The main inspiration was actually my wife Liz when we were just starting dating. She was in nursing school at the time, and I was in like psychology, academic research, which is definitely what I really was passionate about. And it was so clear that she was having such an incredible impact on people's lives, like even as a nursing student. And there was such a need for people to just be where people needed help with a little bit of skills that I immediately started thinking about public health as the next thing instead of academic psychology research. I'd always really been interested in infectious disease, and so that was kind of like an easy pivot, and I could take some of the like research methods and social science information or knowledge that I learned and kind of pull it over to epidemiology.
Oh yeah, easy. Yeah, that's a very seamless. So you knew you were familiar with epidemiology. It wasn't like I had no idea what it was.
Yeah, for sure.
Cool.
One thing that I did
Yeah.
early on
Yeah.
was I reached out to somebody in the public health department of my local county and just asked them what kinds of jobs they have and also what degrees they look for, what skills they look for those jobs. And that was really helpful for me
Yeah.
on like decide because when you're entering a new field, you've got a whole host of options, different
Yeah.
degrees, different certifications, and I kind of had an idea of the end goal of what I wanted to do.
Yeah.
And so I just asked somebody who was already in that role, like, what would be useful to you as like a new grad? And that was really, really helpful to like kind of narrow in my focus.
Yeah, that's a great tip. I love that. You did that. That's awesome. Yeah, I agree. All right. So your current job, can you explain to us your kind of your career path and then what is a typical day? What do you do?
Yeah, yeah. My career path, I worked for CDPHE for a little bit right out of grad school, which was really great. I'm
Yeah.
very glad that I did that. It gave me a lot of insight into how public health is done in reality versus in academia,
Yeah.
which is often quite different. But now I work for Blueprint Biosecurity, like I mentioned, and I work specifically on the FAR UVC program, which is a kind of germicidal light that we think is really promising for pandemic prevention. Um, and my day includes a lot of reading of relevant research. So research on the efficacy of this specific wavelength of germicidal light, but also everything around that. So how blocking transmission in a space translates to case counts in a larger space, or how different indoor air pollution affects basically anything surrounding infectious disease transmission and for UVC. I'm trying to be able to be in a place where I can prioritize and give recommendations for what we can fund or what other people can fund to try to make humanity better equipped to prevent pandemics. And in order to do that, I really need to understand like the whole space and not just like one specific thing.
Yeah. Wow. Very interesting.
It's fascinating.
Yeah.
I love my job. I get to learn so much about all sorts of different areas that I'd never even thought of. And yeah, I love the ability to just bring up a researcher and say like, "Hey, I read this paper. It was awesome. I don't understand like two-thirds of it. Could you meet with me for half an hour and explain this part?" And that's like a privilege that I have that I can just keep learning even after grad school.
Wow. You must like to learn.
Most people who go to grad school
Yeah.
like to learn.
Yeah. Yeah, usually. Yeah. That is really, really cool. So how long have you been in this role?
I've been in this role for about a year now.
Okay. And how did you get this job? Like, where was it, you know, do you think your experience at CDPHE really helped you? Were you able to leverage that? Um, I'm just curious.
CDPHE helped a little bit,
Yeah. Yeah.
but this was the kind of role that I was intending to get. So
Oh,
when I was saying that I kind of designed my grad school experience, my practicum and my what's the other one?
capstone.
I'm
Yeah,
my
yeah, yeah.
capstone.
Yeah,
Thank you.
yeah, yeah.
Yes, both of those I like designed to try to be useful to pandemic prevention research. Um, and then I also started and led a book club on pandemic prevention book with a friend of mine who worked at Laramie County Public Health. Um, I
Wow.
took some courses outside of CDPHE on like biosafety and biosecurity, but yeah, I really used the practicum and the capstone to kind
Yeah.
of design my experience to the job that I wanted. So my capstone was working on wastewater as a predictive
Yeah.
measure for for pandemic response,
Yeah.
and then my practicum was actually working with the biosafety office at CSU,
Oh, cool.
which was fascinating.
Yeah.
And I was able to work on highly pathogenic avian influenza exposure response protocols. So, like, what does the researcher do if the vial breaks when they're working with some pathogen? And I learned a ton there. It was great.
That's amazing. Wow. Okay, cool. How did, in your current position, how do you collaborate with other professionals, or what types of professionals do you collaborate with?
Yeah, it's a lot of academics in my job specifically. And part of that is because the technology that I work on is so new that there's a lot of uncertainty that really needs to be answered by somebody who's like designed to answer questions like that, which is academics. And so it's conferences, it's workshops, and it's also just emails and collaborative channels, Slack channels, and things like that. I also work with policy people and standards people.
Yeah.
Again, because it's a new technology, a lot of the standards and regulations aren't specifically designed to address this technology, and also broadly, they're not designed to to address like airborne transmission and pandemic prevention. There's not a lot of regulations on how a building owner needs to keep their people safe from disease.
Yeah.
That's especially infectious disease. They need to be not be like mold free, but do they need to be influenza free? Not right now. And so it's a nascent space, and people are thinking about it. And yeah, so it's committees also. It's a lot of committees. That's where a lot of work done gets done is in scientific subcommittees to write a report on something or on governmental committees to advise some sort of thing, on committees to advise standards bodies, that kind of thing.
That's awesome. It's very
Yeah,
innovative.
it's definitely innovative. It's exciting.
Yeah.
Yeah,
I mean, just hearing you say like an area could be influenza free, like,
yeah, it's pretty cool.
I mean, my first thought is like, go to daycares.
Yeah,
My
totally,
kids are always
totally,
sick.
absolutely. Yeah, yeah. I think the cool thing to remember is that like people in public health have done this before, right? They're everywhere in the world is smallpox free
Yeah,
because people decided to make the world smallpox free.
yeah,
I live in a place where I don't have to worry about waterborne disease,
yeah,
and I don't even think about it on 99.99% of the days.
yeah.
And that's because someone decided to make it a priority to really work hard and make water not have pathogens in it. And we can do that too for just keep going down the list of the next
Yeah.
disease, the next problem, and fix it.
And that's why public health is so exciting.
Yeah.
It's amazing. It is amazing. It's so cool. And with technology and just the way the world's going, it's just going to get better and better. It's so
Yeah,
cool. Okay, what role does data, community engagement, or policy play into your work? I mean, you did touch a little bit on policy, um, and I'm sure there's data you look at too, but I don't know.
yeah, tons. I mean,
Yeah.
like I said, there's open questions that we need to answer, and so one of my jobs is trying to figure out which are the open questions that are most important to answer, and then go out and figure out who's the best person to answer that question, and then go connect them with funding to answer that question. So it's like it's awesome. I get to prioritize, and then follow through and like make it happen in the
Yeah,
world.
that's
I think
awesome.
one thing that we have to keep in mind is the questions that we have are different than the questions of decision makers. So
Mm.
our recommendations need to be read by the right people, but they also need to be actionable to those people. So what data do they need to make their decisions is something that we have to keep reminding ourselves of. And, it's easy for me as someone who likes learning to go down a rabbit hole of like, ooh, this is a really fascinating sub question,
Yeah.
but that doesn't necessarily mean it's the right sub question to answer right now.
That is very interesting, and you are totally correct. Yeah. And I think that's a lot of public health is, are we asking the right questions? Are we delivering the right data and informing the right decisions? Yeah.
Yeah.
Yeah, definitely. What have been some defining moments or pivotal moments in your career so far? Things you're like, I'm just so proud I've been able to do blank.
Yeah. During COVID, I was able to help run the COVID Recovery Center for Homeless in Boulder County. And that was really, really cool because
Cool.
it was a population that needed help.
Yeah.
And it was a way to help the rest of the community where the alternative was that these people would be in homeless shelters or they would be in hospital beds. And both of those places were not the best place. Sometimes they needed to be hospitalized, but oftentimes they didn't. And the hospital couldn't release them to a homeless shelter because then they would just get 10 more cases in the hospital. And so just providing a place for these people to isolate when they didn't need medical care, they just needed to have a place that they could isolate safely,
Yeah.
was again a perfect example of the like scaling impacts that public health can have if it's done well. If you like isolate, if you figure out what's the right thing to do, you can have a very big impact with a very small intervention.
Yeah.
Another one that comes to mind is something that I can't talk about a ton, but it's
Sure.
something that I'm really excited about. We were able to get funding to a researcher who's been kind of an inspiration to me
Oh,
personally. And they had this research project that hadn't been funded,
yeah.
and I was able to connect them with some funding to answer a question that we really have, and also to collaborate with this person who's been really important to me. So it's been really cool to have
That's
that.
very exciting.
Yeah,
I can't wait till you can tell more
yeah,
about it, but that is very exciting. And what a good, like, amazing achievement to be able to get that person funding so they can do this research, because I'm sure the work is going to be impactful.
we hope so.
That is awesome. Thank you for sharing. In your opinion, or like in your world of work, what do you think are some of the pressing challenges you see in the public health field?
Some of the pressing challenges that I see I'm an infectious disease guy, I'm a pandemic prevention guy. Maybe one thing is like a there's a need for ambition in this space. Just like we were talking about how
So,
it was ambitious to try to eradicate smallpox. And if everybody was trying to do incremental change, I don't think we would be in the world where we don't have smallpox.
yeah,
And so I think there's a lot of people who are doing really important small work, which is essential. And sometimes you need somebody in the space to say, hey, what if we just like radically changed our ambition and tried to prevent pandemics, try to block all flu? What if we tried? What could we do there? And I think that's important. I think another thing is that tuberculosis is the number one infectious disease killer in the world and has been for
mhm,
almost every year in the past couple centuries. with the very small exceptions. And that's not a failure of not knowing how to treat or prevent it. We know exactly how to treat and prevent tuberculosis. And we need to distribute those solutions equitably. We need to actually finish the job and not just do it where it's like people who look like us or who sound like us.
Yeah. Gosh, that was a great answer. I love the ambition one because you're right. You kind of have to be like, no, we're gonna do this and figure it out. Because
Yeah.
yeah, I agree. Wow. Very, very good. Inspirational for public health. All right, trends, and I'm excited to ask you this question. What are some big trends or innovations you see shaping the future of public health?
There's definitely a refocus on infectious disease and specifically airborne transmission and transmission in the built environment since COVID.
Yeah.
Um, there's things that we know can radically reduce disease transmission in spaces, just like having more ventilation in a space can really meaningfully impact transmission risk in a space. The design of a space, and there are small things that can do that, like ventilation or filtration, portable air cleaners, or another thing. And then there are like increasing levels of like technological readiness. And I think that there's promising technologies on all of those things. I think if we focus on this and if we make it a priority, we can radically change the amount of infectious disease that people experience. Not just COVID or flu, but colds. Like you mentioned, your
Yeah.
kids.
Yeah.
Everybody who has kids, whenever I talk to about this, they're like, "Oh my God, if you could just stop me from getting one cold a year, that would be amazing." And that's doable. We can do that if we try.
Yeah. I mean, just walking into the daycare, there's always like
Yeah,
signs up of like, someone got RSV and
yeah,
someone has this. And I'm like, oh no.
yeah. And again, there was signs all over the place of measles and polio, and there aren't because we
Yep,
tried really hard to prevent those, and
true. It's true.
they're not. I mean, measles might be a current challenge now, but we've completely radically reduced them, which is great.
Yeah. Agreed. Yeah. That's amazing. Yeah, you're totally right. It's yeah. I'm excited to see, the future of how we can, make sure we're healthy and, you know, yeah. Okay. So some general career advice that I'd like you to share with us. What skills have been most important to the success in your career path?
Two that come to mind
Yeah.
are really being able to read and understand papers and methods. So there's like levels to understanding a paper. There's understanding the main result, and then there's understanding the main result and how they got it. There's understanding that and also being able to critique it and say like, I know what areas of bias does this have? What is this missing? And then if you're in my position where I'm trying to like fund the high priority of research, it's like, you know, there's lots more questions. So the knowledge that I got from the Colorado School of Public Health, I can think of some specific classes. I want to call it Dr. Elf's class and Dr. Neofito's class, where we just read so many papers and we really dug into research methods. Those classes have been really helpful in being able to understand not just epidemiology papers, but all sorts of papers. The other skill is just people skills. Just being able to work with people. If you want to get something done, people are going to do it. And so, practice asking, practice sending cold emails, practice being open to learn new things. Those are all really important.
Yeah, yeah, definitely. Yeah. There's, in public health, there's just so much collaboration, so much communication skills. I mean,
Yeah.
it's essential. Are there any specific tools or certifications or programs or like professional affiliations or associations or anything that you would recommend for your line of work?
The last part of that question is the most important for my line of work. Like I said, I kind of thought about this ahead of time and found somebody who had my job
Mhm.
and figured out why they got that job, why people trusted them to to take it and run with it. And those things for me were epidemiology and biostatistics skills for sure,
Yeah.
and also just generalized infectious disease knowledge. But I really want to encourage people, find somebody who's in the job you want and figure out what they have, because many people don't want my job, and that's okay. And I think even if you find a job that you think you want and start building those skills and find that those skills aren't fun or they're really hard, or then you can find a different skill, and find a different job. But if you're just kind of hoping that someone out there will hire you, and you don't even know what you want them to hire you for, you haven't practiced, you haven't tried, and so you don't even know if it'll be fun when you get there, if it'll be interesting when you get there.
Yeah, yeah, definitely. And you had mentioned going to conferences. Are there like annual conferences that are, particular to your path that are really good?
Yeah. I think the conferences that I've gone to in the past year are super specific,
I
like
bet.
the International Conference on Far UVC Science and Technology. So if you're really interested in Far UVC or germicidal UV or um, pandemic prevention generally.
Yeah.
Maybe one conference that was fascinating that I wasn't expecting to learn from was the American Association of Aerosol Research. So I'm an infectious disease guy. A lot of aerosol research is like clouds and climate change and stuff
Yeah.
like that. But infectious particles are also aerosols.
Yeah.
So I was able to learn a lot there. But yeah, I think it's super specific for me.
Yeah. That is super specific, but very cool. Very interesting. How do you stay up to date with like the trends? I mean, I know you read a lot of papers, but is there like a newsletter or a professional association or I don't know, website or something?
Yeah, we do have newsletters and professional associations for UBC specifically. I think another way is like build relationships in the space. Just yesterday, actually, a researcher in the space said, "Hey, I've got this manuscript that's coming out soon. You should probably see it before, like, so just so you know." And that is a relationship that I've built over conferences and over workshops and over just people skills and emails.
Mhm.
And that's really helpful if someone gives you a tip. This research is coming out, so kind of people skills is helpful here.
Yeah.
Um, I think another thing to keep in mind is that it's not just about staying up to date. It's also about remembering the whole picture. Right when it's a new emerging field,
Yeah.
it can be easy to get caught up in the last published result, instead of like the
Yeah.
entirety of the published research. And so there's a tension there of like reading everything new, but also reading it in the context of what the field already knows.
Yeah, that's a very good point. Yeah. Very, very good point. Because it's easy to be like jump on the new thing.
Totally. Yeah.
Yeah, I get that. What advice would you give someone just starting out their public health career?
Yeah. I've already mentioned find somebody in the job that you want, but maybe some other advice would be really try to make something practical in your public health. The capticum or the
Yeah.
capstone and practicum are two great opportunities there, where if you try to find a specific problem with a specific person with a specific problem and try to help them with that problem, it's much more useful to you and to the world than if you do something that's just like interesting. There's nothing wrong with doing something interesting. I mean, I still read my academic psychology research books all the time, and it's fascinating. And you can do interesting things on your free time whenever you want. But with the practicum and the capstone, you have an opportunity to actually make something practical, which is then so useful to somebody who wants to hire you. Of
Mhm.
like, this is a thing that they've made that is useful to somebody, versus this is a topic that was interesting and they answered some of their own questions. And then again, people skills. People remember. There's that Maya Angelou quote that I'll butcher, but they don't remember what you say or what you do. They remember how you make them feel.
Yeah.
And yeah, a kind note, a thank you note, goes a long way. I mean, I just the other day had to reach out to some researchers, and I was able to say, "Hey, I have a really good relationship with this professor who is on the same department. Let me see if they can give me a warm introduction." And that was really useful. It helped me
Yeah.
learn a lot about tuberculosis in that specific case.
Wow. Yeah, no, that's a really good example of, building your network, but also maintaining those relationships. I think
Totally.
a lot of times when I talk about networking with people, it's kind of feels like, well, where do I start and how do I do this? But it's really just utilizing, what you know to help meet other people and who you don't, just really getting to know the players in the field, basically.
Yeah. And the amazing part about grad school in public health, at least one of my favorite parts of grad school in public health, was going to school with so many people who wanted to do the same thing. And now, a couple years out of grad school, I have a network of people that are doing the things. You know, if I want to know if I want somebody in a specific area of public health, there's a good chance that I went to grad school with somebody who knows at least somebody who can answer that question.
Yeah.
And so networking doesn't have to just be networking with people that are useful to you now. It can be people who you have no idea how they'll be useful to your career, but it's just good to build good relationships with people, and they can ask you for things, and yeah, it's a really cool opportunity to get a lot of people in one space to talk about nerdy ways of helping out the world, and find those people and then stick with them, and it'll work eventually.
Yeah, yeah. No, you're totally right. I always tell people, I'm like, network with the people in your class. Like, you could be working with them. You could be, you know, they could help you get a job one day. You just never know. You never know. Um,
Absolutely.
okay, but I have to ask you, what is that thing behind you? What is that chart?
Oh, this is a correlated history of the Earth. So we've got like geologic movement of the continents on the left side. We got like, Jurassic, Triassic. This is like evolution of life. In the middle, we've got impacts, craters, and volcanic eruptions. My wife and I have been on a paleontology kick in the
That
last
is
couple of years.
awesome. I
So
was like, what in the world is
yeah,
all that? That's
I've
so
got a lot of
cool.
informational posters on my walls. On that wall is a bunch of immune cells from the book Immune, which is great. This is Rocky Mountain National Park.
Oh,
Good
nice,
stuff.
nice, nice. Very cool, very cool. Well, anything else we should know about your career path, advice, public health? Anything else you'd like to share with us?
Think outside the box. There's a lot of public health jobs that are very common. I was an epidemiologist working for CDPHE right out of grad school, and that was really useful to me. But there were other jobs that were more suited for me, and I was able to figure out those jobs and kind of set myself up for success. And you can do that. Maybe don't expect it to be your first job out of grad school. Maybe expect to do a couple jobs that are more common. But if you really try, you can make your own job. You can design your own job in the world, which is pretty cool.
I agree. I agree. There's so many job opportunities with the skill sets you all learn in your programs. Yeah. Well, thank you
Totally.
so much, James. And I cannot wait to keep my eyes on what you are being able to accomplish with the funding you're providing. And I'm very excited about the future. Um, but yeah, thank you so much for sharing with us today.
Thank you.